Hello and welcome. We are live. Yay, we're doing it again. I am your host, Dr. James Simmons, board certified nurse practitioner, founder and host of Ask the NP. And I am so lucky and honored and privileged to be here with Dr. Anton Bilchik, who is an internationally recognized surgeon and scientist who has pioneered techniques to improve staging in cancer and minimally invasive approaches to improve cancer outcomes. We have a lot of that to talk about. So, this is a second kind of part two of our ongoing talks here as a part of Colorectal Cancer Awareness Month. And we are here today to talk about getting colorectal cancer screenings to underserved communities, which is work that Dr. Bilchik is very, very familiar with. And of course, as a reminder, like we do with all of these things, none of this is considered medical advice, right? This video is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek out the advice of your physician or other qualified healthcare provider with any questions you may have regarding a specific medical condition. All right, we have a wonderful, juicy, lovely half an hour now that the particulars are out of the way. So first, Dr. Bilchik, before we go any further, please tell us a little bit about you and your work with Providence.
Well, thank you, James. And I am so excited and privileged to be invited to talk about colon cancer screening, particularly among underserved communities. In a way, I was starting to get worried that March is coming to an end, and March is Colon Cancer Awareness Month, and you want to cram everything into March as far as colon cancer awareness. So it's just unbelievable to me that April's around the corner. So
Yeah.
I'm just so thrilled that we get to do this before March, before the end of March, and before the end of colon cancer awareness. So I'm originally from South Africa. I went to medical school there. I left in the mid 1980s when things were really heating up, and I was fortunate enough to be able to do my PhD thesis at Yale University. And after my PhD thesis, did general surgery training and continued to do research in the field of colon cancer and other gastrointestinal malignancies. After that, I did my surgical oncology fellowship with at what was then the John Wayne Cancer Institute and is now the St. John's Cancer Institute, which is part of the Providence health system. And I was, again, very fortunate to be mentored by some of the leading surgical oncologists and surgical scientists in the world, in particular Dr. Donald Martin, who really has pioneered so many novel techniques for the way we manage cancers today. We have a fellowship program in surgical oncology that is ACGME approved, meaning that it's one of the few in the country where our fellows get to take their boards in surgical oncology, and we've actually trained within our cancer institute close to 180 surgical oncologists who are leaders around the country, deans, chairmen, heads of departments. So we're very, very proud of our surgical oncology department at St. John's Cancer Institute. And Providence became our took over the Cancer Institute and our ministry about 6 years ago, I believe. And it's really been a great partnership because Providence being the second largest healthcare provider within Southern California and one of the largest nonprofit healthcare providers within the country has really allowed us to get more access to other physicians, to partner with other physicians, and also access to communities throughout, particularly the Western United States. Communities of color, underserved communities, and really give us a much better opportunity to really understand what is needed in cancer care and cancer screening.
Absolutely. Well, and you mentioned partnerships and partnerships that work towards, helping underserved and marginalized communities. And so obviously, you mentioned it's Colorectal Cancer Awareness Month, and I sort of wanted to talk to you a little bit and let you be able to tell everyone watching about your work with Stand Up to Cancer and co-leading their dream team on colorectal cancer health equity, which, the formalities of which, a program that is providing colorectal cancer screenings to diverse and underserved communities. But humanize that for us a little bit. Give us the,
Sure.
like, Dr. Bilchik, what does that really mean? How did you get involved and what is this partnership really up to?
Well, colon cancer is now the second most common cause of cancer-related deaths in the United States. And what we're
Mm,
seeing is really an epidemic among young people, under age 50, being diagnosed with colon cancer. Again, particularly among Blacks and in underserved communities. And we'll go into that in a little bit more detail. But I can't think of any other cancer that is increasing as quickly as colorectal cancer is in younger people under age 50. It seems to be
hmm.
decreasing over age 65, but the statistics are alarming that by 2030, the prediction is that up to 30% of new diagnoses of colorectal cancer will be in people under age 50. So it's become a
Wow.
young person's disease, which is just astonishing.
Wow.
I've been practicing in over 25 years, and we rarely saw anyone under age 50. And I think this has become a national issue, so much so that the screening guidelines for colon cancer used to be age 50, and they just dropped to age 45.
Mm,
Um,
hmm.
and I think many people think that among African Americans, it should be age 40, because so many African Americans are being diagnosed at well under age 45.
Hmm.
Um, and my research has been in colon cancer, as you mentioned, for many years. But I think a large inspiration for me personally to take on this initiative with Stand Up to Cancer was Chadwick Boseman. Chadwick, just the most wonderful guy, wonderful human being, died of colon cancer at the age of
Mm,
44. And,
wow.
you know, Chadwick didn't have any of the obvious risk factors that we think of for colon cancer: obesity, diabetes, eating too much red meat, processed food. Chadwick was a health fanatic, and he was really, an athlete. And he
Hmm.
was diagnosed at a young age. And, he and I had many discussions about what else can we do to, increase awareness. And there really, needs to be a call to action. And so Chadwick was certainly my inspiration to at least start the discussion. And in no time at all, Providence, realizing the importance of this initiative, uh, you know, wanted to become involved. And we also realized that in order to screen within, populations that have much higher incidences of colon cancer, partnering with groups like Stand Up to Cancer, which are, arguably one of the largest kind of cancer awareness organization that provides funding for research and for outreach. That what a great marriage to have a very large healthcare system, collaboration with other universities such as Harvard,
Mm,
and the work with Stand Up to Cancer. And this all just came together very quickly because we
sure.
all recognize that there's a huge need to improve screening among our underserved communities.
Absolutely. And I absolutely love that. And thank you for sharing so much, about Chadwick Boseman being the kind of an inspiration for you to continue this work. And we're, obviously, thank you so much for sharing that. We're glad to hear that. What are, you mentioned screenings. What are some of the sort of specifics that maybe Stand Up to Cancer and this dream team and a collaboration with Providence? What are sort of the specifics in terms of maybe even other than screenings that this partnership is doing to increase awareness and reach out to those communities that are underserved and have such high incidence of colon cancer?
Well, one of the astonishing aspects of colon cancer, which I think most people don't realize, is that colon cancer is preventable.
Mm.
Up to 80% of colon cancer is preventable through
Wow.
awareness that should take place at a young age.
Hmm.
Um, you know, in our 40s, 50s, saying, well, what can we do to improve the way we live our lives may actually be a little bit too late. It likely needs to start at a young age in schools. You
Mm.
know, trying to stay away from processed food, eating, healthy vegetables, exercising, avoiding obesity. I mean, there's many. I think that the clock starts ticking at a young age. So prevention,
Sure.
we really believe starts at a very young age. But having said that, the standard way to screen for colon cancer is colonoscopy. That's
Hmm.
kind of the standard technique that has now been used for a long time. It's very safe. It allows full evaluation of the entire colon. Now, people don't want to talk about colonoscopies because it's invasive, because
Sure.
it's, you know, it involves a bowel prep the day before. It's not a sexy subject to talk about.
Sure.
Um, so people would prefer just to ignore, the discussion about colonoscopies, and colonoscopies as a screening test have been shown to detect these polyps that can become cancerous, remove them, and or if someone has colon cancer, detect it at a curable early stage. Because again,
Mm.
even if colon cancer is detected, most times it's curable if detected early. So
Wow.
colonoscopy is really kind of the standard technique. Now, having said that, what is really important now that we have available to us are stool-based tests that can be done at home.
Mm.
So for people that aren't particularly high risk for colon polyps, or don't have a strong family history, or don't have a history of inflammatory bowel disease, doing a stool-based test at home, and being able to just mail it off to one of these companies without having to do a bowel prep, and with clear instructions, can detect colon cancer up to 92 to 94% of the time. So so
It's pretty
so what
good.
which is pretty amazing, especially for those people who want to be private about it, who don't want to go to that, don't want to have that colonoscopy, who don't want to undergo that bowel prep,
Sure.
to be able to get a kit delivered to your home. And in this case, I'm referring to ColoGuard, which is made by Exact Sciences, and they've offered to sponsor, as part of this initiative, and work with us and community leaders to figure out how best to distribute these tests
Mm.
to to communities and to people who don't necessarily have easy access to get a colonoscopy, or don't, quite frankly, want to get a colonoscopy. So if
Sure.
we can get
Is
these.
this the health action teams that
Yes,
I've read a
yeah.
little bit that you're
So
part
we
of?
need,
Tell
yeah,
us more about
and
that.
and I'll talk about that in a second, because it's one thing having these stool-based tests that are very sensitive to detect colon cancer.
Hmm.
But if we can't get the message out, if we don't know how to get the message out to our communities, it's not going to work. So rather than telling various people, uh, in underserved areas, uh, what to do, we thought that we would create what are called chats, community health action teams.
Mm.
So work with community leaders through churches, barbershops, basically really get into the communities, and then have these team leaders advise us as to what works within the community.
Sure.
What is the best way of communicating? What is the best way of getting these kits to people, rather than a cancer surgeon such as myself saying, well, you know, will everyone please go and get their stool test for colon cancer? That just doesn't seem to work.
Right.
Um,
Right.
you can hear that on TV, but if we can get the people that are respected within our communities, or quite frankly, the owners of barbershops, owners of, just organizations that gyms, people that, are comfortable going to say, listen, have you heard about this test for colon cancer? It'll get delivered to your house in a box that is prepaid. So all you'll need to do is follow the instructions, which are pretty simple, and just, UPS will either, collect this box from your house, or you drop it off and it's done, and you'll get a result within a week.
That's
And,
great.
and this is fully sponsored through this initiative, so it won't cost you a dime.
Which is really, really fantastic. Dr. Bilchik and those watching a lot of my doctoral research was actually in understanding how we can work to prevent HIV in marginalized communities, particularly the communities of younger Black individuals, where incidents of HIV were rising, and in other communities, incidents of HIV was falling. And you really strike on a fantastic point there, Dr. Bilchik, that even though it's HIV and colon cancer, at the end of the day, the bottom line is that people receive information and are therefore able to have behavior change and take action from people who have their shared experiences. So I love that you said, me as a world-renowned colorectal cancer surgeon, which is fantastic and great, but people are not going to receive that message from you in a way that they might receive it from me as a Black man, or like the barbershop owner, like you said, or other leaders in communities. And so I'm elated to hear, on a personal note, as well as just a member of the community, that Stand Up to Cancer and Providence and these chat teams that you mentioned are sort of going about this in a really, really, fantastic way. And are there plans to sort of expand this? Like, are the chat teams doing well, and we're going to do more?
Absolutely. So, just to get to this point, we've had literally people calling us, physicians calling us, family practice groups calling us, saying, what can they do to help? And if this is successful, how do we expand it to multiple communities? I mean, we picked a couple of communities within Southern California, within the Boston area, and within South Dakota, interestingly, because in South Dakota they have some of the lowest screening rates in the country. Particularly among some of the Indian tribes. So we really were, wanted to try and get a real good understanding as to, as you mentioned before, what are the barriers to screening? How can we overcome those barriers, especially for preventable diseases and preventable cancers? And the other issue is, it's one thing telling a community or telling people you need to get tested. Well, what happens if that test is positive and they're uninsured or underinsured? And so part of this initiative was to have navigators within these chat teams to make sure that no one is left alone, and that we will fund people. If they need to get a colonoscopy, that's part of our initiative.
That's huge.
So to see this from A to Z, rather than, okay, great, you told me to get the test, I got the test, it's positive, but I can't get an appointment, with a gastroenterologist for 6 months, or quite frankly, that copay is so high I can't afford it.
Right.
Or my insurance is just horrible, that I'm gonna have to pay for we've got that covered, because we did not want to be part of a program that leaves people hanging.
Amen to that. And it's so integral to actually making a difference in the community and for everyone in terms of colorectal cancer, but specifically communities that are at such high risk, because what we've learned, through years of public health initiatives and all of these things, and organizations like Providence and Stand Up to Cancer in the past, saying, hey, we might have even found the key stakeholders in a community to distribute this information. Great, people are getting screened. But like you said, those few individuals who might end up coming up positive, what happens next? And so the fact that Providence and Stand Up to Cancer are working together to make sure that it is an A to Z, whatever corporate phrase you want to use, right? A to Z, soup to nuts, like front to back, whatever, pun intended, that there's, the care is there for individuals. And, I interestingly, I kind of want to talk, we've talked a lot about, particularly the Black community, but also Latinx and American Indigenous folks have this higher risk for colorectal cancer. Can you explain a little bit to maybe folks watching as to why those groups are they actually at higher risk, or are there some other factors going on? Why, and what else can we maybe do to address that issue?
Yeah, so there's several possible reasons. Number one is access to healthcare and access to screening. Fewer Latinx and fewer African Americans and fewer indigenous groups of people will get colonoscopies, and so just the reduction in screening is one explanation. The second is lifestyle. The incidence of obesity and the incidence of access to healthy food. So, I mean, there's really strong data now that eating a healthy, balanced diet, that does not include processed food and does not include too much red meat and does not include too much fried food, reduces the chance of getting colon cancer.
Mm.
But it's a whole lot cheaper. Sending your kids to McDonald's or Burger King and having a Whopper and fries than it is to go to the grocery store and buy healthy vegetables and to really think about what's going to be in that meal. So access to is one thing, but certainly lifestyle, starting at a young age, is very
Mm-hmm.
much part of this as well, and just a general understanding of the importance of exercise and avoiding smoking and just avoiding some of the other um, causes of colon cancer that we now that we know are really prevalent.
Sure.
The other interesting area of research right now is just our whole body is full of bacteria. We have trillions of bacteria within our body, something called the microbiome. And one of the theories is that if you disrupt those bacteria, whether it's giving unnecessary antibiotics at a young age, or taking too much bacteria through probiotics, that you may be disrupting some of this balance in your body that helps fight disease and helps fight cancer.
Mm.
So again, we constantly have to think, about what we're putting in our bodies that may disrupt some of these, organisms that we have in our bodies that are there to help prevent disease and prevent cancer.
Sure. And to really acknowledge and work towards breaking down some of those socioeconomic, issues and health systems issues at a systems level that continue to cause these disparities in, like, food deserts, for instance. You brought that
Correct.
up. It's a great point. I think, not to put words in your mouth, but when we say things like lifestyle, but we also talk about communities who are traditionally maybe economically disadvantaged, it's not that that you think eating McDonald's every day is healthy. It's just maybe the most convenient
Convenient.
option with 3 jobs and the cheapest with three
Right.
kids, and all of those things happen. And then you unfortunately then putting yourself and your families at higher risk, maybe without even A, knowing it, and B, a lot of other options if you happen to live in a food desert. So you really identifying all of the, health system factors that go into that. And I think one of the things that can really help that is driving Black, Latinx, Indigenous American folks, this motivation for individuals, and creating opportunities for those folks to go into healthcare, to go into research. And I believe, Dr. Bilchik, you're a part of the Health for a Better World program that Providence has that is encouraging this next generation of sort of Black, Latinx, and Indigenous American researchers. Can you tell us a little bit more about that?
Yeah, and that is, also very much, part of this initiative is, is just to encourage, researchers to try and, create mechanisms for funding, to be able to, because a lot, I mean, a lot of researchers will go back to the communities that they grew up in.
Mm.
And so that's very much, part of what we're trying to do within this whole, network of collaborators. Because I think, again, in order for this to be effective, and I'm just absolutely amazed at the level of interest, as I said, from whether it's physician groups, whether it's other cancer organizations, the California Oncology Research Institute, other organizations that want to be part of this, to try and help fund initiatives, fund programs, and try and just change these these big gaps that we have in healthcare within within the country. I mean, the time is now, and I think that we all realize, rather than just looking at numbers and figures, we need to actually do something about it.
I love that. Let's actually do something about it. I just want to remind the audience that's watching, by the way, we have just about 3 minutes left. So now is your chance. You have an uninterrupted chance to ask some questions of one of the world's foremost colorectal cancer surgeons. So I'm just saying, take advantage of it. So if you do have questions, put them in the chat there, wherever you're watching, LinkedIn, YouTube, Facebook, and we will get to those in the next 3 minutes, hopefully. In the meantime, Dr. Bilchik, these are all incredible initiatives, and I'm really, truly inspired by hearing that Stand Up to Cancer in Providence understand the need to have a complete program, right, front to back, beginning to end. So not only encouraging screening and doing it in the right way through ways that communities understand in a way that they'll receive from individuals and organizations that they'll receive it from, but then if there's a positive diagnosis, helping folks get into treatment and care, all of those things. So the man who inspired you to really get involved with this, Chadwick Boseman, how do you think he'd feel about this today?
I could just see him smiling from ear to ear. Uh, you know, uh, Chadwick. The word inspiration. Just truly. Just captivates everything about this incredible human being, kind. If he could, just save one person's life, that would make him, enormously happy. And I know his wife, Simone, who, we're in regular contact with and have become real, close friends with, just sees, that that this is such an important initiative, and loves the fact that we're doing this, as part of Providence and Stand Up to Cancer, and just collaborating with other people, rather than trying to do this in silos. Because I think if there's one thing about Chadwick, he loved people working together to solve problems, than people trying to work alone and not getting anything accomplished.
Absolutely. Absolutely. I'm so incredibly glad to hear that the work continues, and that he would feel like this is good work, and that his wife is involved and continues. That's really fantastic. You have the floor, Dr. Bilchik, for 40 seconds and a captivated audience after this conversation. What, if the audience can take anything away from this conversation today, what is that one, whether it be screening or getting that primary care provider appointment, understanding that the ages for screening is lower now, donating to Stand Up with Cancer, whatever. What's the thing that you want the audience to take away from the conversation today?
Colon cancer is the second most common cause of cancer deaths in the United States, and it's completely preventable. colon cancer has become a young person's disease. Talk about it. Talk about it among your kids, nieces, nephews. Start the discussion at a young age. Don't think of it as something that is only spoken about by older people once they're diagnosed with advanced cancer. This is preventable through diet, nutrition, and lifestyle. So start young.
I love it. That's fantastic. Dr. Bilchik, an absolute pleasure. Thank you so much for joining us. Yes, and everyone watching, I hope you really enjoyed this and learned a lot in the last half an hour. I did too, and even just getting to think about Chadwick Boseman again and hearing about, we talk about legacy a lot with people, and this is absolutely part of his legacy. So thank you for that work, Dr. Bilchik, and thank you for joining us. And of course, for everyone who was watching, wherever you were watching today, please, if you'd like to learn more about this partnership, Providence and Stand Up to Cancer, or any of the other initiatives, programs, services, ways to give, or if you're looking to help, need medical advice, any of that, visit providence.org. You can also learn more about Stand Up to Cancer at standuptocancer.org. Of course, be sure, I got to say this part because we really want you to do it. Follow us on social media at Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. And of course, as a reminder, the information provided during this event was for informational purposes only. If you have any medical questions, please reach out to your primary care provider, physician, or healthcare professional. Thank you. And at Providence, we see the life in you. Have a great afternoon.
Thank you.